Okay, well, I'm your token disruptor. Every conference needs somebody to disrupt, and what I will do is probably incite you and maybe get you a little bit mad, but that's what I do. Don't take it personally. I do it with physicians, I do it with corporate executives, I do it with everybody because that's kind of just what that's what I'm all about. So I'll do that, I'll tell you some stories, and hopefully give you some information to pass. I understand there's going to be a quiz after this or a set of learnings, so hopefully you'll get some crib notes to be able to pass that. Indeed, I appreciate, John, the introduction. I had a lot of trouble keeping a job because there's so many interesting things happening. And today, when you talk about connected health and you see the number of people here empowering ordinary people to take control of their health, it's one of the most interesting areas that you can possibly get involved in. So I'm really excited, and I hope I can share with you some of that excitement. Indeed, I'll be telling you a story about the Media Lab, but let me begin by inciting you a little bit and just telling you about what my thought process is in the kinds of research and the kinds of technology that I get involved in. The way I see it, the healthcare system is very complex, and we all say, what's wrong with the healthcare system and how can we fix it? It's enormously complex. But I would say that overall, if there's a single reason why we're in the situation we are today, it's because the medical industrial complex, if you will, has forever underestimated the power of ordinary people to take control of their own health and to play an active role in their health. Why that's the case? Maybe you can answer that better than I can. Probably has a lot to do with history and what I call design point. As an engineer, I think about design point when designing systems. And, before 100 years ago, if you go back 500 years or even 1,000 years, well, healthcare was all about acute care. I always think about that shtick of Saturday Night Live where Dan Aykroyd comes in critically injured, and I think it's Steve Martin there who's I think he's the butcher, or maybe who's the doctor at this time, and he's the high priest, and Dan Aykroyd is kind of the servant. And there was this kind of chasm or asymmetry between the high priest of medicine and ordinary people. And basically, healthcare was about acute care until about 100 years ago, when antibiotics and vaccines came on the scene, and lots of good medicines and therapies. But if you think about it, the design point for healthcare was acute care. And it really needs to change dramatically as we move into a world where the design point really needs to be for chronic care, because people are living longer. And the world really demands that we change the design point. However, the asymmetry that existed 100 years ago or 500 or 1,000 years ago between medical professionals, if you will, the high priest, and ordinary people has continued to grow. And we've talked a lot about empowering people, but today there's still a tremendous asymmetry. Where we look at it as a point of view of a technologist in the Media Lab, this is kind of perplexing, because so many other areas of technology and society really have changed, where the balance of power between those at the top and those at the bottom has really almost shifted. Now, we can buy online anything that we want, we communicate, we connect, we collaborate together, we do all kinds of things that have empowered us in ways that you couldn't have imagined before. And our view is quite simple. Sooner or later, this reversal of power must occur. Technology will become a major catalyst for this. But the question is, who will do it and how will it happen? And that's where this wonderful place that John was talking about comes in. I was privileged to be director of the Media Lab for 5 wonderful years. It was kind of a sabbatical for me. I'm an entrepreneur. And when I got to the lab, I saw all the wonders, many of the things that you use today on the internet. Your Kindle comes from the Media Lab, the display on your Kindle, games and toys and so many things that are part of our lives. And we began to ask the question, why can't those same technologies that empower people in so many other ways be brought to the world of health? And so that was kind of my mission for the 5 years at the Media Lab from a kind of an academic and a research perspective, was to stimulate the students and the faculty to think about, in very, very disruptive and different ways, how technology could empower people, and to engage in projects and programs that did just that, and do what you do at the Media Lab, which is just build it. You imagine it, you build it, you test it, you try it, and you keep going. Failures are considered successes, and serendipity is often what causes the greatest inventions to happen. So what I'm going to do is just tell you the story of 4 students at the Media Lab who I was very close to. I was thesis advisor for 2 of them, and also on the committee for the other 2, who went on to form companies in this area of what you might call connected health or health IT, and really talk about how far have we come in really tapping into the ability of ordinary people to take control of their health, but also make the point that a lot of these innovations that are required to disrupt healthcare will come from outside of the healthcare system, from places like the Media Lab, which are just, open, creative environments where invention is the name of the game. And that's where I think a lot of the innovations will come from. Meet Anmol Madan. Anmol was a PhD student at the Media Lab, and on the left here, he's demonstrating one of his early projects at the Media Lab called the Jerkometer. Now, has anybody heard about the Jerkometer out there? Anybody used it? One person. Well, it was just one of about 20 different projects that Anmol created. But the purpose of the Jerkometer was basically to listen to you as you talked on your phone to determine whether or not, using just an analysis of your voice, the tone, the tenor, the words you used, the pace of speaking and so forth, whether or not you were being a jerk with the person on the other end. Now, what does that mean? Well, you're on your computer, you're on your laptop, you're doing your email. How many times over the past week have you been a jerk? Okay, while you're talking to a business associate, a son or daughter, your wife or husband or somebody. And so Anmol wanted to discover whether or not you could do that just by listening in, using natural language processing and machine learning and all those other good kinds of algorithms. Well, the Jerkometer, it made a little bit of a splash, as projects often do at the Media Lab. But it also led Anmol on a long journey that brought him to Ginger.io, where the basic idea is, by passively monitoring, by looking at what people do in the course of their everyday life, you can actually determine whether or not they're sick or they're going to be sick. And it's just this basic concept around which he created Ginger.io. By looking at, empowering people to just opt into a system where their communications, their movements, and other passive capabilities or passive parameters are monitored. How can we as medical professionals now use that information? Interesting, they're working with about 20 clinical organizations, and what they've discovered is that for people who are trying to self-manage diabetes, that basically when they get off of their medications or they're not doing a good job, their communications increase by 30%. The number of people to whom they call in the course of a day increases by 35%. And their geographic travels decrease by 70% using the GPS on the phone, telling you that the behavior of ordinary individuals can actually be surmised by these passive signals, and they tell you a tremendous amount. Ginger.io is applying that across the board, not only to diabetes, but to mental health issues and other disabilities or other conditions. It's very fascinating, I think, to think how you can actually unleash the power of ordinary people by not requiring them to do anything. Please meet my PhD student, Ian Eslick. Ian, like everyone at the Media Lab, or very few people at the Media Lab were doctors. Ian was a world-famous computer scientist who created his own company back in 2000 that was ultimately sold to Broadcom for $1 billion. He opted to come back to the Media Lab as a PhD student, and he just got passionate about the idea of how he could deal better with his condition of psoriasis. And he noticed that among his friends with psoriasis, they were always conducting experiments. We all conduct experiments with our health. You know, if we have a condition, we might say, does sleep help? More sleep, less sleep, diet, exercise? We're always trying different things. And he created a website called personalexperiments.org that enabled ordinary people to run their own N-of-1 trials effectively, to become data scientists in their own conditions. And he ran this in clinical trials or clinical pilots for inflammatory bowel disease, for sleep disorders, and for cystic fibrosis, patients with cystic fibrosis. And just one quick story of a woman, a mother who came into an emergency room with her son who had been coughing very frequently over the past few days. And the doctor said, well, this looks like it could be an infection, bacterial infection, not uncommon with cystic fibrosis. We're going to put the young man on intravenous antibiotic for a few days or for a week and see where it goes. And the mother then whipped out her smartphone. She had been participating in a personal experiment with her son and showed the doc that in fact most of the coughing had occurred at night. They had actually plotted coughing using some sensors and other capabilities, and convinced the doc not to put the child on antibiotic right away, but just to give him a steroidal inhaler and watch it for a day or two. This was an ordinary person, the mother of a child with cystic fibrosis, who was using a big data tool to draw conclusions about her son and working in collaboration with her doctor. A very inspiring case. It was true. The child was put on an inhaler. Within a day or two, the coughing subsided and the child was released from the hospital. Just an example of how we can unleash the power of ordinary people, in this case, the mother of this child, to use these kinds of tools to better understand their conditions and to better understand themselves. Meet one of my favorite guys, Vitor Pamplona. Vitor is from Brazil. He was a postdoctoral student at the Media Lab. Vitor started his first company when he was 15 in Brazil, and today that company is the biggest supplier of computer services in Brazil. His brother runs it. But Vitor, who built the world's first 3D video game for smartphones, came to the Media Lab after he was introduced to an ophthalmologist who had the idea, perhaps, that some of these technologies could be used to help people better understand their eyesight. There are 2.5 billion people in the world who need glasses. And Vitor went on, together with a group of colleagues at the Media Lab, to develop this $2 clip-on to a smartphone that enables anyone within about 5 minutes to do their own refractive eye exam. And to within the accuracy of about 0.5 diopters, which is what you'll get from your optometrist when you go in and get an eye exam. Together with Vitor and Ramesh Raskar, who's his professor, we formed a company called iNetra that is today taking this technology and bringing it to the developed world. We have implemented a future version of what you see here in India. And what really is exciting is we took this device to a small city outside of Mumbai, about 2 hours outside of Mumbai, and trained high school graduates for about 2 hours to give tests at kiosks in malls in this small town. 400 people were then tested in the period of about 1 day at the mall, and 200 of them got eyeglasses who never had eyeglasses before. Here again, I think we're seeing unleashing the power of these high school graduates to become effectively medical professionals in collaboration with patients. We hope to put this device in a number of developing countries throughout the world, and we hope to change the game in eye care. Let me introduce you finally, one fourth story, to John Moore. John was my PhD student at the Media Lab, and he completed his work in July, and some of the folks here were at his thesis dissertation at the Media Lab. John is an exception to the students that you saw here. He was a doctor. He was an ophthalmologist, as it happens, who was doing his internship at Johns Hopkins and just noticed as he was doing it that he spent all of his time filling out paperwork and not having his patients listen to him. As an ophthalmologist, he would often prescribe drops for patients who had eye conditions, and they would come back in a week or two, and he'd ask them, did you take the drops? And they'd say no. Okay, and he'd say, you've got to take the drops, otherwise you can become blind. Well, he did enough of this, got frustrated, and enrolled at the Media Lab, became my student, and created a platform called Collaborithm. This is his passion. It's a platform for enabling doctors or medical professionals to collaborate with ordinary people to make them apprentices in their own healthcare. It's a very interesting observation that he made. Students at the Media Lab are apprentices to the faculty as they learn the art of innovation from them by doing. Apprentices learn by doing in a situated learning environment. And John thought, well, could I really apply the same concept to how patients can learn about their conditions and take better control by being educated in the process of controlling their conditions? He also observed that doctors and medical professionals learn by apprenticeship. So he created this platform called Collaborithm. It uses just about every technology you can imagine, tablets and smartphones, machine learning, avatars. You see Linda in the background, that's an avatar here. The basic idea of which is to allow say a coach, a health coach, or maybe even a non-medically trained person to work with patients to enable them to manage their chronic conditions better. He also created this as an open source platform that every year attracted hundreds of people to the Media Lab to build their own solutions on top of the Collaborithm platform, and did several clinical pilots, one of which was at the MGH Center for Practice for Ambulatory Care, where John applied the platform to about 50 patients with hypertension. And he found the following thing, working with David Judge at the Center for Ambulatory Care, that at that center, which is probably the best of the best, it takes about 12 months to get about 50% of patients to 140/90. These are patients newly diagnosed with hypertension. With Collaborithm, which put a lot of the responsibility in the hands of patients, we were able to achieve 140/90 in 3 months for 100% of patients, and then 130/80 in 3 months for about 80% of patients. These were results that blew away Dr. Judge and the folks at the Ambulatory Practice Center at MGH. We aim to spread this throughout the world. Our dream would be to bring this method of apprenticeship for empowering patients widely throughout the world. Another advantage is that one health coach was able to manage 5 times as many patients to achieve this result. So once again, we experience time and time again at the Media Lab that by thinking beyond the boundaries that people think in today and experimenting, that not only were we underestimating the power of ordinary people to take control of their health, but they constantly exceeded when given the right tools and given the right support, they constantly exceeded our expectations in every one of these clinical trials. We really need, as a medical profession, as commercial healthcare providers, as academics, to change our mind from asking the question, can people do it, to then saying, we believe that there's almost no limit to what people can do and control their health if we do the right job. So we really discovered 2 things at the Media Lab in the course of these projects and the companies that have spun out. Number one is I think a lot of the innovations that I talked about will come from outside of the medical profession, the academic medical profession, the practice of medicine, the commercialization of medicine, but it will almost always occur with innovators like these students at the Media Lab working very closely with clinical organizations and medical professionals. That's going to be, I think, where the win is going to come. And we need to do more and more of that, and that's why I really am excited about what's happening here at Connected Health and bringing these together. The second thing that we discovered, it's not going to be all about empowering medical professionals with new tools and capabilities and information. It's not going to be all about empowering individuals with the ability to take care of their own health. It's going to be empowering both to collaborate together and to look for a new design point and a new model in the era of chronic care and aging that defines a new ecosystem that binds together doctors and patients and medical professionals of all kinds in a new kind of connectivity. In short, I think if we take this vision, we bring together these kinds of intellectual and invention forces and medical forces, that really this can be the thing that changes the world forever. Thank you very much. Those are my comments.